Good evening, everyone. This is Stephanie, and I'm going to be speaking on Chapter 19, and we'll talk about coding data. I chose this because my role is the RN Quality Coordinator at my organization, and I use a lot of coded data. First of all, I'm going to talk about the textual definition of coding data. So the text describes coding as the process of transforming data into symbols, usually numbers, and it can be used for many different reasons in healthcare, such as research, which is what the text really focuses on, quality improvement, billing, and external data reporting. So the text also talks about some high-level considerations for accurate coding. The variables should be in the same units, such as like pounds versus kilograms. Responses should also be of the same precision or caliber, such as measuring to the nearest quarter of an inch versus a half an inch, making sure that everybody is consistently doing it to the same caliber. And then everyone should have a clear definition of the codes, and these codes it sounds very easy in theory. However, in practice, you'll run into situations where things just don't necessarily fall under a certain code, so it actually becomes more problematic than it sounds. The text also talks about the concept of pre-coding, and that occurs when the codes are designated before the data are collected, typically easier in quantitative type of data. However, data from open-ended questions can still be used, but the codes may not be able to be assigned ahead of time because you may need to gather a few of the responses in order to really know what to anticipate that you're going to code. So I'm going to talk about coding in healthcare and actually how it applies to my daily life. We use coding in a number of different situations. We use it in our patient safety reports. We may code the type of event, the contributing factors to the event, the outcome of the event. All of that can be coded in order to facilitate the running of reports. I'm going to talk about coding in the sense of assigning numerical or alphanumeric representations to the clinical documentation. So this is the coding that your coding department does within your organization. We've been using ICD-9 and CPT codes. However, beginning October 1st of 2015, we moved to ICD-10 codes. You may have also heard of SNOMED codes, and those are really used in the meaningful use for our electronic record, and what that does is they allow electronic systems to communicate with one another, even in other countries and across languages. We're going to talk a little bit more about ICD-10 codes. They're more robust and specific than ICD-9 codes, and what they do is they take a diagnosis or procedure and map it to a numerical value. This next slide kind of shows how it does. The example is a laparoscopic appendectomy, and for all ICD-10 PCS codes, they are 7 characters long. The first character talks about the section of the ICD-10 PCS, and for a LAP-API, the section is 0 or medical surgical. The second character refers to the body system, and this is in every ICD-10 code. The body system in this case is the GI system, and that is given the category of D. The third is the root operation. In this case, it's a resection, which is a category T. The fourth character will always refer to the body part. In this case, it's an appendix, which is a J. The fifth character relates to the approach. In this case, it's percutaneous endoscopic, which is a category 4. And the character 6 relates to the device. And in this example, there is no specific device, so it's given a Z. And the same for the 7th character, which is a qualifier. There's no specific qualifier, so this is also given a Z. So the code for the ICD-10 code for LAP-API is 0DTJ4ZZ. So the uses for ICD-10 coding, we use it for volume statistics. This can be used organizationally or per provider. We also use it for billing, which goes hand in hand with compliance, because if we're incorrectly coding, we're going to be incorrectly billing, which can get us into compliance trouble. We also use it for external reporting, and we also use it for organizational and provider quality metrics, such as complication codes or patient safety indicators, which are coded from the medical record. So some of the challenges to ICD-10 coding, it has to be very specific, which means that the provider documentation must be equally as specific, and many times it is not. We also have challenges to compliance because of billing, and education, because this is a very new and much more robust and much more complex way to code than it was in ICD-9. We also have very specific coding guidelines, and those refer to kind of the hierarchy or sequence of coding events. And then we also use coded data for quality reporting now, which is relatively new. The benefit to this is you are able to get a large, robust amount of data. However, the data integrity issues still are being worked out and are still somewhat problematic in the quality arena. So thank you for listening and have a good week.